Kay Walker here, and this is question number 2 of the top 10 burning questions from my Depression Angels. Today, I'm answering the question, how do antidepressants work? I love this question because I think there are so many cases where people are walking into their doctor's office being prescribed these medications and taking them blindly without really knowing what they do. And it's really important to understand that because they're working on the brain, which is the most important organ of the body that controls everything we do. So, in order to understand how antidepressant medications work, you first need to understand some basics about the human brain. Now, the brain has approximately 10 billion brain cells, and these brain cells communicate from one to the other. They send messages from one to the other. One brain cell could have about 25,000 connections with other cells. So based on the information that's being processed, one brain cell will send a message to another brain cell, and that will have your body operate in some fashion. That's how we work as humans. That's how our body runs, and that's how our brain works. So here's a picture of two cells. We have a sending cell and a receiving cell. If you think of a sending cell almost like a pitcher throwing a ball and the receiving cell catching the ball, then that's kind of the same relationship we see here. So a chemical message is being passed from the sending cell to the receiving cell. Now, in between these cells, we have this small area here. It's called the synapse. Now, the synapse is important because what happens here, you'll see these little dots here in my picture. These are neurotransmitters, and neurotransmitters are simply chemicals that allow the transmission of a chemical message to be passed from one cell, the sending cell, to the receiving cell. What happens in someone who has depression is that for one reason or another, they will have a lack of one of the key neurotransmitters that regulate happy mood. For this example, I'm going to talk specifically about serotonin. When a chemical message is being sent from the sending cell to the receiving cell, the serotonin moves out into the synapse, and then the normal process would be that it would be reabsorbed by the sending cell. Now, what happens in someone's brain when they don't have enough of that serotonin chemical, it will reabsorb faster back into the sending cell because the sending cell is hungry for it and needs it, and that means that less of that chemical will be absorbed into the receiving cell. So what an antidepressant medication does, it stops that reabsorption process from happening. It leaves more of the neurotransmitter serotonin in the synapse, which equates to a better mood. Now, if your loved one's been prescribed a selective serotonin reuptake inhibitor, this is what it's doing. There are many other types of antidepressants, but they all work in a similar fashion. They just work on different types of neurotransmitters. Lastly, I want to caution anyone who's thinking about taking an antidepressant medication. These are serious drugs that work on the brain. Many experts believe that taking antidepressants may have detrimental side effects, more side effects than we know at this point. Antidepressant medications can actually alter the brain's anatomy. In my Lead with Love course, I talk in more depth about how the brain works and the concept of neuroplasticity, that the brain is plastic and always changing. Now, antidepressants will actually alter the brain chemistry. So if anyone is actually, starting an antidepressant, they need to be watched carefully. They need to be watched if they're ever changing the dose or ever going off the antidepressant. In all cases, I suggest trying everything else first, natural supplements and diet and lifestyle changes, to see if that improves mood first. And for some people, antidepressant medications are very beneficial and necessary, especially for severe cases where nothing else helps. Bottom line, before anyone takes a medication, make sure they consider all these factors and that they're being closely watched on a regular basis by their doctor.